So tonight we're going to talk all about options for your first job as a qualified physio. And there's always a huge amount of discussion amongst students and those who just graduated about what should I do? Should I be doing rotations? Can I take a static job? Should I be working in the NHS if I'm in the UK? Should I be working privately? Should I work overseas? And so we this evening are here to try and talk to you all about that. I've already seen the question in the chat. Can we catch up on this video later today? Yes, absolutely. We'll also be putting it on YouTube so you can watch the whole thing there as well. So it's a pleasure for me to introduce Bella and Alex, two of our clinical physio buddies. The first thing I'm going to do is ask Bella to give us a quick 30 seconds about her and the physio job that she is now working in immediately after her graduation. Go ahead, Bella.
Okay, thank you. Hi everyone, my name is Bella. I'm 21 years old and I'm a new grad. I graduated this year from St George's University of London and I recently started a Band 5 rotational job. So I'd been to secondary school, I went straight into sixth form, and then from sixth form I went straight to uni. So I'm quite young in terms of graduated physios, but I'm really loving it. Yeah, so I am currently a Band 5 rotational physio. My first rotation I am doing medical, so I'm on my third month of that now. In my current job, the rotations are 4 monthly, so I haven't got too long left of this one, and then I believe my next rotation is in surgical, so I'm looking forward to that.
Super stuff. Thank you so much, Bella. And Alex, take it away. Tell us about you and tell us about your physio world at the moment following graduation.
Yeah, no problem. So I graduated in June 2020. I am a musculoskeletal physiotherapist. I currently work in NHS as a static role. I cover a lot of different sports, come and do a lot of sports clinic, and I also work privately. I was sort of same route, came out of university, went rotational, but then it wasn't for me, which is obviously why I'm on this video today, to talk about my experience. And yeah, I absolutely love my job at the moment, and I'm quite excited to do this evening, so thank you very much.
Super duper. Thank you both of you, and absolutely great that we have a mix of rotational and static, so thank you both for joining us. And ladies and gentlemen, if you're on the chat, please smash that like button for Bella and Alex to say thank you for joining us. Right, so first of all, we're going to discuss rotations. So naturally, I'm going to come to you first, Bella. So just to give people a little bit of a background about rotations in the National Health Service, the NHS in the UK, if they're not familiar with it. As Bella said, often every 4 months or every 6 months, you will rotate to a different area in the hospital. So it could be like Bella, you started on the medical unit, you then might be going to the surgical unit, you then might be on the stroke unit, you then might be working in orthopedics, you then might be working in MSK, musculoskeletal, but it gives you the opportunity to sample all of those different areas for a 4 to 6 month period to effectively try and help you gain knowledge in all areas so that you can perhaps make a decision about which direction you want to go in. So Bella, tell us a little bit about your personal aims when you were coming to the end of your student life and why rotations worked for you.
Yeah, so as like many people, my placements were affected when I was at uni due to COVID. I didn't actually really get an acute respiratory placement as well as other placements that I just hadn't experienced a lot really. All my placements were kind of similar. So I wanted to opt for rotation just to gain that extra experience, kind of dive into areas of physio that I hadn't yet touched, and kind of I wanted to build on those well-rounded skills that I knew I could carry kind of anywhere with physio. I guess I didn't really know, well, I still don't know what I want to specialise in, and there's so much I'm interested in, and I didn't want to make a definite decision at the time when I was finishing uni, so I kind of opted for rotations to get that wider experience, kind of, I guess, find what area I want to specialise in and kind of work on my skills and learn new things as well, because as I said, I hadn't done acute respiratory before, so it's all new. Well, it's not new to me as a 5, but I'm getting to do a lot of things I hadn't done as a student. So that's really my main reasons for doing rotations. And yeah, it's just, I think it's a good option post uni for myself. As I said, because I don't know really what I want to do. I have an end goal. I think I want to either go into MSK or neuro, but it's, for me personally, I didn't want to go straight to that and then think in 5 years, oh, I wish I gave that a go, or what about that? Like, I kind of just want to tick all the boxes and then see how I'm feeling with it, really.
Absolutely. Yeah. And goodness, you know, you mentioned you're 21 years old. You've just graduated as a physiotherapy student. Sometimes it's very difficult to make a concrete decision for the rest of your career, or so it might seem, at that time. So it makes perfect sense that for you, you weren't, especially when you didn't have the experiences that you were hoping to have on placements due to COVID, it's natural that you wanted to do a little bit more investigating. And the other question I was going to ask is, did you have any particular rotations in mind that you really wanted to try and get involved with as a junior physiotherapist? I know you mentioned MSK and neuro, but were those the two main things, or were there other rotations that were of interest to you?
I am interested in hopefully doing, well, kind of under my medical rotation, we do have, you see some pediatrics. So that's something I wanted to try and see. I've only really worked with adults before as a student. Although some of it's the same, there's also a lot of things that are different, and how you can adapt your practice to make it like games and things like that. So that's something I definitely wanted to try out. Again, that was completely new. And there's also areas of physio that are quite niche, like women's health physio, that I also want to try. There's just so much out there, and I'm like, oh, I see that, and I'm like, oh, I'm interested in that. Oh, I like the sound of that, and it's like, oh, I just want to kind of, yeah, keep going with it, and yeah, seeing what's happening. I'm quite open to any rotation, especially at my trust. They're only 4 months, so it's not really too long, but I feel like it is enough time to get to know if you like something or not, and kind of hone in on your skills. So yeah, I'm quite interested in all of it, really. And then also A&E, I think that's a really cool one to try out. There's so many.
I think, as you said, that's one of the biggest benefits of rotations as a junior physio, is that there is so much out there. And I suppose a lot of people feel as if they might be missing out, like you said, missing out on the opportunity to sample all those different areas. And naturally, as might come on in a second with Alex, there might be, you might have a very concrete, focused direction in your mind, and you think, this is the thing for me. But as I certainly found, one thing that I hopefully add to Bella's story about rotations is that I thought that it was absolutely nailed on that I was going to be a musculoskeletal physiotherapist. And I remember not having the best respiratory placement as a student. Completely my fault, I must add. I then went and was working, I started out actually doing static MSK for 18 months before then going into a rotational role. So I really had both sides of the coin with regards to being a graduate physio. And I found that I actually really enjoyed respiratory as a junior physio. So it just goes to show that being a student and those experiences you have as a student don't mean that it's going to be that way forever. I certainly was someone who didn't think that they would enjoy respiratory at all as a qualified member of staff. And there you go. I really enjoyed it. I enjoyed ITU. I enjoyed being on the acute respiratory unit. And and I went from there effectively. So thank you so much for that, Bella. I'm sure we'll come back to some more things about rotations, but let's dive in on Alex and what you've been up to. So first of all, same as Bella, tell us about your current job role. I know you mentioned NHS, static, pediatric. What does your week look like? It must look like a real mixed bag.
Yes. So I'm very lucky. I've had a lot of people offer me a lot of really, really good experiences. My working week's pretty much everywhere, but it's fab. So I work Mondays, Tuesdays, Thursdays, and Fridays as an NHS physiotherapist in the musculoskeletal team. And then weekends slash sometimes midweek, we do some sports clinics. So I predominantly work and cover football and rugby. So like this weekend, I've been lucky enough to have the opportunity to work with England Touch and go to Cheltenham. So yeah, it's all about the experience. And then privately, that's all predominantly done on Wednesdays. So in that job, I work as an orthopedic sort of assessment guy, I'll call myself. So basically, we get predominantly hips, and we work with a lot of orthopedic surgeons. We assess them pre and post-op, work in a private gym, and it's got all the fancy gear in there. It's got all the high-tech stuff, and it's just a good... The beauty of my sort of job role is you get to see both sides. You get to see the people that obviously maybe not afford privately or have healthcare insurance or anything like that. So, but then you also get to see the people that do, or the facilities that you can see the difference that you pay for. So yeah, and especially skill wise, your skills develop a lot more going from all different jobs. So like in sport, see a lot of acute injury. We see a lot of when do we refer on, how do we do it, and when you're in a semi-pro club, you haven't got any connections out, how on God's earth do you get someone looked at by a consultant and that sort of thing. So yeah, and then you're also developing your links, you're getting to have all these different experiences, and it's all just about, I think, like I said when we did the intro roles to each, just taking every experience that comes at you. If you can't fit it in, obviously have a social life. But yeah, if you can definitely take the opportunity when you're a junior, absolutely. I totally 100% behind myself with that. So yeah, my working week, I don't actually have specific hours. It's just all about planning way ahead. So like, for example, with the private stuff, I've already planned into October and covered all that month, as well as the sports stuff. And then obviously NHS doesn't change. So yeah, it's all about planning, I think.
It is a little bit all over the place, but I suppose what we can probably see from what you're saying is that there's definitely a musculoskeletal focus to your work. So tell us a little bit about the decisions that you might have made that led you to the path of, I'm going to try and be relatively static. I know you said there's some pediatrics in there, there's some orthopedics in there, but it's mainly musculoskeletal. So tell us about what helped you make that decision.
So I think not the bad part of universities, but the focus part of universities, I'll say, is a lot around rotational posts. And I think it's great when you sort of not in the mindset of what you want to do, but myself sort of graduating from university going, yeah, I do want to work in sports where I originated from. I do want to do musculoskeletal practice. But at the same time, because everyone else is on the bandwagon and that was what was aimed for, and we even got prep on how to interview for a rotational post, not how to sort of go for a static post. So I think it was very fixated on this rotational post, and as everybody can see that's applying for jobs recently, and they're all sort of aimed at that, and there's a few static ones coming back up, but it's all just about that. So I think it was very focused, and it was almost like a forced decision I put on myself, like it must be this great thing because everyone goes on about it. And then, don't get me wrong, in my rotational experiences, I had a great time, met some fantastic people that I'm lifelong friends with, you know, and get to meet up with them every now and again. It was just fab. But being in patients was not my thing. I think that's the thing that sold it to me. I had enough of mobility assessments. I'd had enough of doing handovers with nursing staff and chasing doctors in the orthopedic acute team and trying to find out what all these different things were and scribbles and all that sort of thing, and then having to sort of organise my day in that way. And I think that sort of thing that pushed me towards outpatients. And then I got a fantastic opportunity for the private stuff whilst I was doing inpatients, and became sort of a self-employed role. And I think the more I did it, the more I fell in love with it. And it sort of steered me into, right, I think it's time to apply for a static post, and thankfully got it. So that was sort of my experience for that, if you like. So, starting as a band 5 in private practice is always a great question, because people feel there's a difference of private practice compared to NHS, which there is in what you've got available, but not in the clinician. Everyone is more than welcome to helping you. They're actually quite excited that band 5s want to start in private world rather than what's the band 5 doing here. Does that make sense? With regards to what it's like, it's very, very different to NHS. So there's not those pressures of getting people seen in that short time. They're very accommodating. So if you need an hour to spend with like a new assessment whilst you're getting used to it, they're more than happy to accommodate that. You've got a lot more to play with. So like you can try all the different things in the gym, and they'll happily do inductions for you and take you around it, and show you how everything works if you're not aware of what they do and what they are. As well as this, you get a lot of access to specialists in private. Okay, so for example, we've got an upper limb specialist who does a lot of elbows and shoulders. We've got lower limb specialists. We've got spinal. We've got pain team. We've got mental health or behavioural medicine teams in there, and everyone's really, really open to support you. So say, for example, if you have an elbow question, the specialist will most likely say, well, if you book some time with us, more than happy. So I'd say the big difference is you don't really have an assigned supervisor, if you like, and it's down to you to manage when you want sort of supervisions or time to talk through clinical stuff. With regards to updating your skills as well, I would say that's very much more on you, but I see that as a positive because you learn a lot about yourself. And you'll sort of learn how to direct it. So say, for example, you're really, really struggling with a patient and you feel like out of your depth and things like that. Don't panic is the first thing. And then when you come out of there, you can ask lots and lots of different clinical specialists, and they will most likely give their opinion, or you can just book them straight in with them and watch them do their work. There's nothing wrong with that neither. So yeah, I think the big things taken from this is make sure you're open and honest and say what you're really comfortable with, what you're not comfortable with. Make sure everyone's aware that you will be asking them for support and sitting down with them and wanting to book time out, which everyone will be fine with anyway. And just keep an eye on what you want to achieve in the private practice. You know, some people love it, some people hate it, but some people really, really want to strive in it. And you can, as long as you put it down to yourself, work hard, but most importantly, enjoy it.
Yeah, Alex, I think those are some really, really, really great reflections that you've made there. And I think that's the main thing, isn't it? When you've got a student moving into the junior phase of their career, the thing that they're most concerned about is the opportunity to learn. And I suppose what you've clearly highlighted from your experience is that there is definitely opportunity to learn and people to learn from and courses and things like that. But it might just have to be that you are more proactive in organizing that, and that there may not be a focused supervision once a week unless you ask for it, or that there's not going to be CPD time specifically unless you ask for it. So that's a really, really good point. And I suppose if I could offer any advice on this, it would probably be that if you're going to be working in a private practice as a junior, make sure you speak to them beforehand and clarify, what do you offer and what can I do in terms of learning, and what will the options available to me be in terms of learning. And you can certainly demonstrate that it's something that you're really quite keen to make sure that you get, and you're really keen to make sure you have those opportunities. And as long as you say that and that the practice is able to meet you halfway in terms of that, then why not? I suppose so. What you kind of summarize that, if I may, you had the opportunity to do some rotational stuff, and you had the conviction in your head that actually this is the direction I want to go in, and good on you. And some might suggest it was a brave decision to go, oh, I'm going to go static, but some would also say, no, good for you. If you were confident that that was the right answer for you, why shouldn't you be happy to go and go for a static post? So yeah, that's absolutely super. Before we go into the next section, a couple of questions that hopefully both of you could help us with. So a couple of people asking in the chat, when did you start applying for your first set of jobs? So if I remember all the way back to 2008 when I graduated, I probably was starting to look for jobs around March of that year, knowing that I was going to be graduating in July. What was the situation for you, Alex, first of all? How far into your 30s were you applying for jobs?
How did I apply for jobs?
Or how long into your
how long in advance? I think for me personally, it wasn't something I was stressing over. Physiotherapists always needed people. You know, if you don't get it as soon as your mate doesn't get one, it's not the end of the world. Just keep up your CPD and just keep going. I applied. off the top of my head, I think about March time, ready for
Cool.
June. So yeah, I was proper last minute ducky, if you like, to some people. I know that some people got jobs in October, which I thought was way too early, and sort of missed a dissertation and things like that. So yeah, I applied quite late, I think.
Fair enough. And Bella, how about you?
So I think I started so on the NHS career, if you're looking to work in the NHS, on the careers website you can set up alerts. So I think I set the alerts up in around March time, and all new jobs get emailed to you every day, so you can kind of keep an eye out that way. And then I think it was about April time I actually started applying to some.
Cool.
It kind of worked out that way with my uni schedule, what was going on with my assignments and dissertation and things like that, like when I could kind of fit it in, and I wanted to give my full attention to it and not just apply for a job half-heartedly. So that was like kind of the time when I thought, this is like, I'm going to try now. So yeah, it was April time for me, and then I got an interview in May, and then I started the job in end of June. So I wouldn't say there's a right or wrong answer in terms of when you should start applying. You've got to think about, do you want to start working straight away after uni? Do you want to have a break? Because realistically, if you have an interview in May like me, they might not wait around for you until September if you want a summer break. They might be short-staffed and need someone to start as soon as possible. You kind of got to think about different all that kind of thing when you're applying. I wouldn't say there's any harm in applying for practice. I think that's a great idea, but if it's a job you really, really want and you want to work there, then you've got to think, can I start work me to?
No, I completely agree. I think that I remember when hopefully a question that I've seen in the chat as well, and that lots of people have asked me a lot of times, is very something that Alex said a second ago, which really resonated with me. Oh, my friend got a job last month and I haven't got a job. Hand on heart, I didn't get my first physio job until about 6 months after graduating, and I went through a countless number of interviews. And so it just goes to show that it will happen, it can happen. And it was only after 6 months that I realized, crikey, I've just had 6 months off and I've spent the whole time worrying about whether I'm going to have a job or not. So if there is that opportunity for you and that's what you want to do, then go for it. If you don't mind, I think I'll take the next question, which is, are you allowed to decide which type of rotation you want to do next, or are the options given to you like placements at university? So having been involved in kind of that decision-making process where different band fives are going to be rotating, it's important to say that a trust has to try and balance the needs of the individual member of staff as well as the needs of the department. So, for example, you may find that relatively early on in your rotations, like Bella perhaps, you might find that you're doing some form of respiratory-based rotation, because it will allow you to go onto the on-call rota if you're working in an NHS-based hospital. And it might be that if you really want to do musculoskeletal, but they need you to do respiratory first, or they encourage you to do respiratory first, then you might find that happens. Don't worry if that's the case. You, of course, will get onto it. But yes, as the question was asked, quite often trusts will offer you sort of a first choice, second choice, third choice, and then they will try and allow you to meet your choice as much as possible. Bella, is that something that happened to you with your second rotation? I don't know if you had much choice in your first one, but how did it go for your second rotation?
No, so I didn't get I kind of just got given it, which I'm fine with, because as I said earlier, I'm very open to everything. But I'm pretty sure if you are really keen to do a certain rotation next, then you can kind of speak to the head of the department and kind of make them aware of that, and they can do what they can to make that work. But as you said, it depends on the needs of the department and what the other fives have done and what they need to do.
Exactly. I've got to say, it's really difficult if you're a junior member of staff on rotations. You think, I haven't got my rotation, I haven't got rotation. It's really hard for those making those decisions. There's about 20 people they've got to make happy, and that's really difficult. Let's move on to pros and cons, as it were. So Bella, if I could come to you, let's have a little bit of a chat about some of the pros of rotation. So for example, you've mentioned already the opportunity to do lots of different rotations. I know that a lot of people talk about one of the biggest positives about rotations is learning the skill mix in different areas and then being able to substitute that when you're working in a different area in the future. Is that something that made a difference for you, or is that something that you've already found yourself thinking?
Yeah, 100%. I mean, again, like I said earlier, it's one of the reasons why I wanted to do rotations, is just to become more well-rounded in my skill set. But yeah, definitely, like I'm using like neuro skills in medical, and like I'm having to do some neuro assessments to make referrals and things like that. So you definitely, it all does cross over 100%. In terms of, I guess other pros would just be learning. It's just, there's so much learning that you can do if you're changing rotation every months. Especially at most trusts, they do like in-service span 5 training. So although you might have learnt some of the stuff at uni, they kind of give you a refresh.
Yes.
Like when you're there, which is great, or they teach you new things that you don't learn at uni but are also useful on the rotation. So I guess that's a massive pro of rotations. I would say another one is kind of like the interdisciplinary working that you get in. It's not just like, well, it is nurses, doctors, etc., 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 but it's those kind of disciplines, but in all the different areas as well. You'll see specialist ones of those as well, if that makes sense.
Absolutely.
Yeah, so I find it great learning off those as well. And I just find it really interesting to see what other disciplines do, what their roles are, and that kind of thing. I'd say that's a massive pro. And yeah, I just also getting to know everyone in the whole of the kind of physio department. You kind of be paired with people. For example, the 5s that I'm working with at the minute, I'm working with one of them on my next one, but then also someone I haven't worked with before. So it's kind of like always changing up your team, like every 4 months for me, which is great. Yeah.
Absolutely. And as you said, you get to meet lots and lots and lots of people very regularly. I mean, some of the key things that I've noted down myself about rotations is, as Bella was alluding to, the breadth of knowledge, but also there is such a crossover that you don't necessarily think about at the time. So, for example, having done an orthopedic rotation as a junior member of staff, if someone has a total knee replacement, a total hip replacement, or a spinal surgery, for example, I've worked on those wards so that when I then work in musculoskeletal settings, I know exactly what they've been through. I know exactly how the ward works in order to get there. If we're thinking about working in a musculoskeletal environment, if you think that that's not what you want to do, actually that could be really, really useful if you're then going on to an intermediate care or a rehab ward where you will be using musculoskeletal principles in order to help your patients there. How about something like COVID-19? You know, that's a real mix of lots and lots of respiratory, but then when patients have perhaps long COVID afterwards, they need lots of cardiopulmonary needs as well as musculoskeletal needs if they've lost a lot of strength. We had a brilliant webinar the other week with Tiffany, who is a pelvic health specialist, and she highlighted how much pelvic health is not mentioned both on the wards and in a musculoskeletal setting. And it's so, so important. So if you've done that rotation, you'll be able to bring those skills elsewhere with you. So I think those are some of the other key things about rotations. So coming on to Alex, if some people have already asked in the chat, and of course it's worth asking because you're on, how did you get involved in your sports club environment as a junior physio? What kind of avenues did you take in order to do that?
So mixed sort of things. One of my roles was sort of from when I was playing, so I went down back to one of my local clubs. To be perfectly honest, you will be surprised where you get offered jobs. So, like for example, currently in the job that I work in, we've got a few physios that work for Liverpool Football Club. So hopefully next season might be sort of building a link there and helping them guys out. You might just be having coffee, talking to someone, and they go, oh, such and such. Sport's one of those weird things. It's a little bit of who you know, but if you prove your worth, you're going to be known to a lot of people. So, like, for example, when I do some pitch side cover, people already know who I am. I'm trying not to blow smoke here, but people who know who I am, they've heard about me, they say, oh, you also work here, and then sort of they're looking for other people. And sport, especially semi-professional sports, always looking for people. Always, always,
Yeah,
always. It is
absolutely.
so open, especially rugby nowadays. All the guidelines have changed. They do need qualified physios or even physio students to have like a Lubas medical course or something like that. So by just saying you've got this certificate, they will snitch you up like no tomorrow. Professional sports a bit different. Obviously, you need to apply like you would a normal job. But if semi-professional sports part-time, it's a little bit of fun on the side, you know. Totally recommend just getting involved. So yeah, I was just quite lucky in the fact that people knew who I was, I knew who people were, we got chatting, went for a beer, had a bit more of a chat and go, actually, yeah, okay, I can offer some assistance for this season, that sort of thing. That's literally how it happens. Yeah, so yeah.
I think, as you said, there's a huge demand, and lots of people may not recognise it. I suppose the one thing that, and I wonder if you might agree with this, Alex, one of the things that you might find for your very first sports job is that you're not going to be the Liverpool Football Club physio from day dot. It might well be that you need to, you know, demonstrate some interest in working for a lower level Sunday league football team to start with, or an academy team where you're dealing with mainly teenage and younger child grassroots football. But if you can then demonstrate that, doing that a little bit part-time, you can go from there. And I know lots of physiotherapists who started off doing a rotational physio job, but then did some sports in the evenings. I know lots of people who wanted to do musculoskeletal work, but were doing rotations like Bella, but they managed to keep their hand in by working on the wards during the day. And then a couple of evenings, maybe one evening a week, they went and visited the sports club. Or perhaps like Alex, one evening a week, he does his private work. And that's how you can keep your hand in the musculoskeletal sector whilst also learning your trade in the inpatient and community sectors.
Yeah, absolutely. I totally agree. I think it's just a place of working hard, showing what it's not being the best physio in the world. It's just, you always got to start the lowest of the low. You know, I've been there as a pitchside assistant. I've literally done holding a bucket or holding the sick bucket or getting the stuff out of the bag and being that guy. I've been there, done that. Once you got all your qualifications and you get a sports that's contacted you, you'll be flying. I feel like I work professionally, but I really don't. I go out on a Tuesday and it feels amazing just to be stood pitch side and just being able to help people, and that's pretty much it. And to be honest, you soon sort of find in MSK you sway away, I think. So even though I love doing the sport, I don't think I could ever work professionally in sport. I feel like that would be just too much, but I love doing it. So you might find yourself like you actually do a little bit of semi-pro, or you do even amateur, do a bit of amateur just on a Sunday or a Saturday or whatever, and you go, this is for me, or this isn't for me. So I think it's like in rotationals or like anything like that. So I definitely recommend starting lower, and it's less pressure as well. Yeah. A lot of the lads don't know what a physiotherapist is. They might call you a sports therapist, a sports rehab guy. They might just call you the guy that comes in and rubs people. You know, it can be a bit of anything. There's really no pressure. And especially when you've got someone that will guide you and help you out and just sort of take you through the routes, starting at a lower level is really, really good experience. So I think that's why they asked for it, to be honest.
Super. I suppose that probably brings us, ladies and gentlemen, towards the end of tonight's discussion. But I think the key things to highlight here is, number one, as Bella said, Bella's going down the rotation route. She didn't know necessarily what she wanted to do when she graduated. She didn't have the opportunities to do all the placements she wanted to do during COVID-19. And she felt she had a lot of learning to do in lots of different areas, and to be able to do that whilst meeting lots and lots of people at the same time is really important. We then had Alex, who's working in lots of different sectors, but mainly in a musculoskeletal capacity. He decided that that was what he wanted to do, and he had the confidence to go for it. If I may mention myself briefly, as I said, my first job was static in an occupational health musculoskeletal role. I worked there for 18 months, and then I was a junior physiotherapist doing my rotations, and I did that for about 3 years. I then went to be a static band 5 MSK physiotherapist for a further 2 years. So I can honestly tell you, I've done a lot of it. And I think that if I may summarize, one really, really key thing that I think puts a lot of pressure on people when they are thinking about their jobs is the pressure of making the right decision. And if I can give you any advice about that, don't worry. So many people panic. If I do rotations, then it's going to take me 2 years to go through that, and then I'm going to be static. Many people say, well, I really want to do MSK, but if I don't do MSK, then I'm not going to be able to learn the trade of rotations. I'm someone who's been there, done it, went back, went forward, and turned around again. And I can honestly say, you are good enough, strong enough, skilled enough to be able to change anything you want about your career. And if you think to yourself that the average physio career is about 30 to 35 years, if you have to spend 5 of those 35 years trying to work out which direction you want to go in, you still have loads of time left. So basically, make a decision. If it's the right decision, great. If it wasn't the right decision, don't worry. You're good enough, skilled enough, and strong enough to be able to do something different. And that's, you know, that's something that happened to me. And Alex has already mentioned that he started in rotations. He was confident enough and skilled enough to think, actually, no, I want to go into MSK. That's what I'm going to do. And he went on from there. So I think that's my parting message, if I may. Don't worry. Whatever decision you make, even if it's the right one, great. If it didn't work out so well, don't worry. You're still going to have loads of opportunities to do what you want to do. So I suppose that just gives me great pleasure to say a huge thank you to Bella and Alex for joining us. Before we go, Bella, any last thoughts, any last words of advice that you might give everyone from our discussion tonight?
I think my main thing would be what we were talking about earlier, is about don't stress about getting a job straight away. It will come, and everyone's on their own path. Don't compare yourself to peers. And yeah, as you just said, you've got like 30, 40 years working. So don't think you have to reach your ultimate goal as soon as you graduate uni. You've got think about the stepping stones to get there, is what I'd say. Thanks.
Spot on, Bella. Absolutely a pleasure. Spot on. Alex, any final words, any last bits of advice from our discussion tonight?
Join MS. No, joking. I would say enjoy it. Whatever job you go into, go with open mind. You make mistakes, you can step backwards. There's no pressure from going down from band 6 back to band 5 and going back to rotationals. Nothing wrong with that at all. Just enjoy being a physiotherapist. It's a great profession. As I'm sure the other two will say, and there's a bit of that cliche of university tell you, but it is honestly, and it's a very supportive place. People will understand whatever decision you make.
Yeah. Very well said, both of you. Thank you so much. Two great ambassadors for clinical physio. It's an absolute pleasure to have you on, and fantastic advice that you've given us. So thank you so much. And that gives me the chance to say thank you to all of you for joining us. But otherwise, from myself, from Bella, from Alex, thank you so much for joining us, and we'll see you very soon here on Clinical Physio. Night, everyone.